Cat. We're actually going to go through Kitty's post-vaccination documents she got yesterday when she had her first dose of the Pfizer vaccine, and talk a little bit about the stuff that's in it and what I think about it. I'm an ex-ICU nurse. I work in Toronto, Canada, and I'm currently a hospital administrator on nights in a major teaching hospital, so I will examine the package and let you know what I think. But first off, I am crushed and disgusted and disappointed. There's no sticker. I wanted a sticker. Human beings are very fascinating creatures. At this point, millions of people have had the Pfizer vaccine. So you'll see this news report, and I will break the news report into bits and discuss it, and I'll get into this stuff.
Right now at 5:30, how safe is the Pfizer COVID vaccine? We are investigating the death of a South Florida doctor who passed away 2 weeks after getting his shot. And we have reaction from that doctor's family.
And we're also now hearing from Pfizer as well as the Florida Department of Health on this one. Local 10 investigator Amy Viteri is live with what she has learned. Amy.
Well, Dr. Gregory Michael passed away on Sunday, just a little over 2 weeks after getting a COVID-19 vaccine at Mount Sinai Medical Center. But right now, it is not clear if his death is linked to that shot that he got back in mid-December.
A couple of things here. They're not investigating this at all. What they're doing is they're reporting on the news of it. They're not looking at lab samples, they're not looking at his clinical history. This is not investigating, and it's a public thing, so they're not finding out something we don't know. This isn't not an investigation, this is news reporting, and it's somewhat duplicitous to pretend that they're doing this investigation. But the other thing I'd like to point out is that it is unclear at this point whether it's related to the vaccine or not. But whatever, it's good for news, isn't it?
The Centers for Disease Control now looking into the death of Dr. Gregory Michael, who received the Pfizer COVID-19 vaccine on December 18th.
The CDC is investigating this. They are investigating any reports of adverse reactions to the new vaccines, as is Health Canada doing the same up here. This isn't unusual that they're doing this. This is totally what they expect and what they will do. There will be people having adverse reactions to any new medication and any new virus, and there will unfortunately be some people die.
The 56-year-old got the vaccine at Mount Sinai Medical Center, where he ran a private practice as an OBGYN for the last 15 years. A Facebook post by Michael's wife describes him as very healthy. She says 3 days after getting the shot, he noticed severe broken blood vessels on his feet and hands, prompting him to go to the emergency room. Diagnosed with something called immune thrombocytopenia, which prevents blood from clotting. Writes, he got a hemorrhagic stroke caused by the lack of platelets that took his life in a matter of minutes.
What you won't get from sensationalized clickbait news like this is the fact that so far everything in place to protect the public from the new vaccine is in place and it's working, and they are looking at it. There has been no cases of this as far as we're aware in any of the clinical trials. It would not be surprising if you give any medication to 5 to 10 million people, if people would react and die from that medication in tiny numbers. That doesn't mean that we would stop the medication or the vaccination process in this case. We have to look at, if 5 million people catch COVID-19, how many of them would die? And that's literally what they're going to look at. There is no safe medication in the world. All medications affect the ability of the human body to be in normal stasis, and normal stasis, if disrupted for a tiny fraction of them, or large numbers with some medications, like arsenic, will have adverse effects. This isn't something I particularly worry about. Now, Kitty got the Pfizer vaccine yesterday, and so far she is doing okay. She woke up this morning with severe muscle pain in her left arm. So again, if you're having the vaccine, have it done in your non-dominant arm. If you're right-handed, get it done in the left, and vice versa. And she felt the whole body was like unable to get out of the bed this morning, which was very transient, a few seconds and she's fine. And as the days progressed, her arms got better. Now, could she get ITP and die from this? Yes. If she does, will I be upset? Yeah. Will I then go online and say this vaccine has to be stopped? No. Her chance of death from COVID-19 is vastly higher than her chance of death from the vaccine.
Spokesperson for Mount Sinai citing patient privacy restrictions, telling us in a statement, to the extent that we are aware of an incident involving any patient, the appropriate agencies are contacted immediately and have our full cooperation. Florida's Department of Health confirming they referred the case to the CDC for investigation. A CDC spokesperson telling us they will evaluate the situation as more information becomes available and provide timely updates on what is known and any necessary actions. The vaccine manufacturer Pfizer-BioNTech also responding in a statement, saying they are aware of the death of a healthcare professional 16 days after receiving a first dose. We are actively investigating this case, but don't believe at this time there is any direct connection to the vaccine, saying there have been no related safety signals identified in trials or vaccinations so far.
Well, Dr. Michael's family has asked for privacy during this time. His wife writing on Facebook, he was a vaccine advocate. He was also a father. The medical examiner's office telling us as of now the cause of death has not been determined, and that is something they say could take several weeks. The CDC, of course, tasked with reviewing vaccine safety, telling us their thoughts are with the family. They say to date, more than 5 million people have received COVID-19 vaccines in the United States. Of course, this is a story we are going to continue to follow, and as soon as we get new information, we will share that with you.
Well, you don't really respect people's privacy by putting their photographs up after they've died. I'd like to point out there's almost 26 million doses of vaccines have been given, and mostly it's split between Pfizer and Moderna, with most of it being Pfizer at this point. So having one person develop an adverse reaction to the vaccine, if in fact it was to the vaccine and not just one of those random things, it will be interesting. It's also interesting when you have somebody with no platelets, because you can get this from other things other than vaccinations. It's very rare. The treatment itself can cause the intravascular hemorrhage in the brain, which killed him. So it's interesting. They're going to have to really look at a lot of data. Was this caused by the vaccine? Unknown. If it was caused by the vaccine, will it stop vaccinations? Absolutely not. If we start to get significant numbers of people hemorrhaging to death and bleeding to death, having had the Pfizer vaccine, pretty sure they'll stop it. So far, out of 26 million, the only one I can really find is one person. That's pretty good odds. So you don't get a sticker or a badge. You do get your next appointment time, that's kiddies, and then you get a package, sadly devoid of stickers, I wanted a sticker, and you do get a bunch of information. Now I'm not going to show this, and I've obscured it, but you get this, which is basically an immunization first shot passport, and you have to take this for the second one, and I wouldn't lose these. You get a privacy statement on the first page, and it tells you a whole bunch of things and gives you web links. What it basically means is if you think your privacy is being compromised, you can talk to all these people and talk about it. It just says you will be receiving a COVID-19 vaccination today, and we're collecting data on it because we want to see if you're going to die, because if a lot of you die, then we'll stop giving it. But they actually want to find out what's going on. We want to keep an eye on it, right? And it's by law and all the rest of it. So that's the data piece. Pfizer BioNTech COVID-19 vaccination information sheet from the Ontario government, and this tells you a whole bunch of information, and it's dated, and it's the version 1, and it may get changed because things change. So it basically gives you the basic information you need, gives you website links, tells you what you should be doing. It's been evaluated and authorized for use in Canada by Health Canada using vigorous standards. They're going to continue to monitor it to make sure it's safe and effective. And that's something the anti-vaxxers keep rattling on about. Absolutely, we can't give this vaccine for 2 to 3 years using our normal approach to developing new vaccines. Given this is a new virus and it's killing a lot of people, we are jumping and altering the way we progress in producing vaccines to get an effective vaccine out. And of course it has to be monitored. Actually, all vaccine reactions are monitored automatically. It tells you what COVID-19 is, which is kind of funky, you might not know. Tells you the signs and symptoms. One of the signs and symptoms it doesn't mention is pink eye. That seems to be a sign and symptom you should take seriously if you've got pink eye. You shouldn't go out and about in public anyway because you can infect other people with your pink eye, but you should possibly consider getting a test done for COVID-19. Right, so here's some facts up into December in Ontario. Of the people diagnosed with COVID-19 in Canada, about 1 in 13 require hospitalization, and about 3 out of every 100 people diagnosed with COVID-19 die, so about a 3% death rate. Even people with mild symptoms may feel unwell for a long time after COVID-19 infection. What percentage? We don't know. It seems to be 22%. Tells you how the COVID BioNTech vaccine works, tells you what type of vaccine it is, mRNA virus, and you can receive and not receive. So you have to have the 2 vaccines 21 days apart. Other countries are spreading it much further than that, which is fine, except it's not guaranteed to work. If you have any symptoms of COVID-19, you should not take the vaccine. This is important. People are going to go, well, I haven't really got a headache. If you've got any symptoms, do not take the vaccine. You are risking your health. If you're getting another vaccine, you have to wait at least 14 days after having that before you get the COVID vaccine. We need to know which vaccine you're reacting to. Tells you to call Telehealth Ontario, total waste of time, but they always do that. So this is more detailed information on who should and should not receive the vaccine and precautions that should be taken. And this stuff's always worth reading. I suspect very few people are reading this prior to getting the vaccine. So it tells you what you should do if you're acutely ill, you shouldn't have it, all the rest of it. If you're immunosuppressed, if you're on cancer, chemotherapy, and other types of autoimmune disorders, you probably shouldn't take it because we don't know if you'll live or not, because you were excluded from the clinical trials. Talks about hypersensitive anaphylactic reactions to some components of it. They basically are going to have a doctor on scene and they'll give you epinephrine. If you actually collapse and die, I'll get hives. And there's very few of that happening. And like I say, there's been millions of people injected and quite a few 100,000 have had the second dose of this vaccine. Any adverse reactions at this point would be noted that are significant. And by significant, I mean large enough to warrant a hold on the vaccination program. If you're pregnant and if you're breastfeeding and if you're below a certain age, you shouldn't get the vaccine either. Pregnancy seems to be kind of correlated with COVID-19. They say it's about the same as the general population, but I've seen a lot of COVID pregnant women in my hospital. And in fact, the doctor that died is an obstetrician. So what are the ingredients in the vaccine? So these are the ingredients in the vaccine. As you will see there, it's vegan and there are no baby bits in it. The one thing we're identifying is polyethylene glycol as a major cause of problems. Now it's in a whole bunch of stuff like cosmetics, skincare, laxatives, cough syrups, bowel preps for colonoscopy and some food and drinks. Now Kitty's had colonoscopies and she hasn't reacted to it, so we kind of figured she'd be fine. I haven't had a colonoscopy, maybe I'm allergic to this, we'll find out. So the actual injection is given into the deltoid muscle, very high, it's a deep intramuscular injection, so it's going to be sore. What are the risks of the vaccine? They're studying it. They found no serious side effects to date. None. And they are continuing to monitor it. Now it talks about other vaccines because we don't know, so we're guessing. We talked about mild signs and symptoms like swollen glands, mild fever, joint pain, muscle pain, all that sort of stuff, tiredness, headache. Some people can progress to a disorder called Guillain-Barré from pretty much most vaccinations and from flu and colds themselves. It isn't actually significantly higher with COVID-19 vaccination from Pfizer or Moderna or any of them that have been studied. Can you get COVID-19 from this vaccine? No, it's not a live vaccine. So that's one of the other things. People think, well, you can get HIV. That was one of the things that went around. No, you can't catch HIV from this vaccine, nor can you catch COVID from it. What measures have been put in place to provide safely immunisations during COVID? They're trying not to have infected people administering the vaccine, they're monitoring them quite closely, and they're using PPE. During the immunisation you have to wear a mask and you have to be 2 meters distance. Kitty assured me that was happening and everybody was doing that. Okay, you're going to go for a vaccination. What should you wear? What should you do? This stuff is really helpful before you go, by the way. Wear a short sleeve t-shirt that's easy to roll up because they're going to have to go into here, right? Eat something before you come to the clinic because we don't want you to feel faint, and especially as guys get faint with needles. Wear your mask. They may not be able to provide them. Bring ID required by the clinic, such as your health card, and that's what they had to do. She had to provide her Ontario health card. So I'd like to know right now, what are we going to do about the undocumented in Ontario who don't have health cards? I'm not altogether sure that's what we should be doing. But this is, again, we haven't opened up vaccination to the general public yet, and I'm fairly confident Ontario will look at how we're going to vaccinate the uninsured, the illegals if you like. Bring your immunisation record with you, if you have one, and it tells you all different things, as you'll see, bleeding disorders or medications. So for me, when I'm going to get my vaccination, I'm routinely taking aspirin now because I have mild hypertension. It's protective against colon cancer, and it might be slightly protective against COVID-19's side effects. We don't know. But I will be stopping aspirin about 1 to 2 weeks before I have my vaccination. What should you do after you get the vaccine? Wait at least 15 minutes, and they make you wait just in case you're going to collapse. We'd rather have you collapse there with a doctor there in resuscitation, and we haven't had to resuscitate anybody yet, though we have had people faint. It's quite common. So Kitty's worried about the arm soreness. She's worried about driving back from a second injection, but the arm soreness seems to be coming the next day. Now she is scheduled to work, so she may not be able to go to work the next day. We'll see. So these are the list of things that you should look out for and tell a doctor if you get them after the vaccination. Hives, swelling of the mouth or face, trouble breathing, very pale colour and serious drowsiness, a high fever over 40 centigrade, no idea what that is in Fahrenheit, but it's very, very, very hot. Convulsions or seizures, other serious complications, e.g. pins and needles or numbness. So once you've had the COVID-19 first and second vaccines, you have to wait at least 28 days before you get any other type of vaccination. So if you're planning on going on holiday, and why would you be, you have to be very careful about that aspect of this. So like I say, by actually putting the date and time on, it's pretty obvious when your next appointment is. So they have an aftercare sheet, and I think that's somewhat important as well. It's basic guidance. It's issued from the Chief Medical Officer of Health in Ontario, and it tells you what you should do, and it's a form of a directive. Our Ministry of Health directs things. It's kind of like law, but it's a directive, and I'll let you read that yourselves because it's kind of fascinating. So having had the vaccine, you still have to wear a mask and keep social distancing and wash your hands. It's not effective. It's about 50% effective about 3 weeks after the first one on average, and on average it's about 95% effective about 3 weeks after the second vaccination if you give it within the 21-day period. If you decide, like some countries are doing, and wait 12 weeks before you give the second dose, the effectiveness is probably not going to be 95%. And again, they're letting you know the symptoms and side effects so you can take care. That's what they want to do. The immunisation receipt is in effect an immunisation passport if they so choose to use it that way. Well, I hope you enjoyed this. Good luck to everybody out there. We need to hug and kiss each other, especially the ones we love. Life is never certain, and right now it's less certain than it's been for quite some time. And I'm sure that we will get through this, but we are looking at 2 to 4 months of absolute nightmare in the hospitals and the economy, possibly longer. It's probably definitely not shorter than that. But around about April, May of 2021, we should start to see the actual light appearing at the end of a very dark period of human history. And we need to not forget that nature can decide to kill large numbers of us anytime it feels like it, especially if we abuse nature. We need to really restrict our use of natural areas and pressure on natural animals, and we need to really revamp and think about how we care for the animals we choose to eat. So from me, hope you like this. If you like it, give me a sub, give me a thumbs up. If you don't, give me a thumbs down and never come to my channel again. Have a great day. Toodles. This was a New Terrier 2021 production.